We know that Steward has gone bankrupt. We know that several of its hospitals have already been forced to close their doors because they ran out of money. But the question that is interesting to me is, in the midst of all of that, how is the main person behind all of these efforts, Dr. Delatorre, how's he doing financially? While hospitals shut down, while patients go without care, while healthcare workers lose their jobs, how has Dr. Delatorre been doing in terms of his own financial well-being? And the answer is that he has been doing phenomenally well. While Steward was busy shutting down hospitals, the companies he owned received $250 million in compensation over a 4-year period. Let me repeat. He personally received hundreds of millions of dollars, some of which, remember, hospitals shut down, patients without care, workers being laid off, and some of that money he used to purchase this $40 million yacht. Our first witness is Dr. Delatorre. But as I think everybody can see, Dr. Delatorre is not here. Dr. Delatorre is not present in the room at this time. So I now call up our second panel of witnesses.
Thank you, Senator Sanders. We have 2,800 Massachusetts Nurses Association nurses and healthcare professionals working at Steward hospitals. I'm proud and honored to be representing them today. We hope that we can provide a unique perspective on this issue, because we are the front line providers. We provide more than 90% of the care delivered at Steward hospitals. Probably the most tragic, and what finally blew the lid off all this, was the death of a 39-year-old woman who came to the hospital, had an absolutely normal childbirth, was bleeding. She may have been saved by a device known as an embolism coil. There weren't any in the hospital. There hadn't been any in the hospital for weeks. They had been repossessed by the vendor. She died. Steward has also caused the closure of Quincy Medical Center, and now Neshoba and Kearney Hospital. Kearney Hospital sees more than 30,000 patients a year. Boston EMS takes 6,000 patients a year to Kearney Hospital. Where are they going to go? We don't have the capacity in Boston for this. I know we have a lot of hospitals. We also have a lot of patients. And just to be clear, we need not to let this happen again. And thank you for coming together, and it's my sincerest hope that you can put an end to this. Thank you.
Thank you very much. Ms. Sprague.
My name is Audra Sprague. I'm a registered nurse. I worked at Neshoba Valley Medical Center for 17 years. Steward Healthcare systematically extracted every possible dollar that they could get out of our hospital until it led to its closure 12 days ago on August 31st, 2024. Our hospital is licensed for 57 medical beds, plus 20 geriatric psychiatric beds. Of the 57 medical beds, by the time we closed, we probably had around 18 to 20 working beds. So working under these conditions became overwhelming for everybody, nurses, doctors, anybody in the hospital at every different level, due to the chronic understaffing and lack of supplies. Steward's greed has put lives at risk, and their action is going to kill people. And it's left a complete hole in our community that, despite the warnings and pleas, nothing's been done to stop them. They have unchecked greed across the board, and it's not just a business failure, it's a human tragedy waiting to happen in our region.
Thank you very much, Ms. Sprague.
We know that more than 2,000 patients were endangered by Steward Healthcare, according to the Boston Globe Spotlight team. They were grandparents, parents, children, aunts, uncles, nephews, nieces, friends, community members. But for those corporations, private equity, those profits came first, meaning the patients came last, and ultimately just left it to the nurses to try to deal with this situation as it unfolded. And this was a situation where every patient meant something special to the families and to the nurses as they tried to help. Ms. McGinnis, you saw the faces of these patients. Can
Yes,
you,
Audra,
can you
I-
talk about, can you talk about these people and their families and what the impact on them was?
When a patient becomes less well or they die because the resources that they need were unavailable, that's greed. And it's a gut punch to know that you won't be able to do for that patient what you know that patient needs.
And thank you for telling the American people what has been going on with Steward Healthcare. And our pledge to you, and I think I speak for Senator Cassidy, is, well, we are going to pursue this. This is not the last discussion of this. And if Dr. Delatorre thinks that he is comfortable by not being here today, Dr. Delatorre, if you're watching, you're wrong. This will be pursued.